welcome. It's Chris from Christopher Hole Training, and welcome to this week's whiteboard. We are talking about scoliosis treatment, and specifically we're talking about massage. There are other treatments out there. You could use exercise, stretching, foam rolling, even as far as surgery to treat scoliosis. But what I want to focus on is something that's manageable for people, something that is effective for people, and something that, in a sense, doesn't put them into that scenario where you have to have surgery. It's something that you can use to manage the symptoms of scoliosis, obviously depending on the extreme nature of the scoliosis or the nature of the scoliosis. If it is extreme, then surgery might be the best option. If it's mild, then massage, stretching, exercise, foam rolling, those types of things will be just as effective, and if not better than surgery. So that's what we're going to talk about. We're going to focus on two things. We're going to review the muscles involved, and then we're going to review possible muscles and areas of the body and the spine that you might think or that you might want to massage. This video isn't necessarily there for self-diagnosis. It's more there for upgrading your knowledge around your condition. So when you go and see a professional, or when you decide if you want to do it on your own, you can think about stretching, foam rolling, exercise, or even some self-massage. You've got a better understanding of doing it yourself, because everyone has the opportunity to treat their scoliosis in the way that they choose, and this is just giving you a little bit more insight to it so you can make a better and more informed decision around how you treat it, whether you do get a professional involved or whether you do it yourself. It's completely up to you. So before we get into that, just want to mention my social media, which is on Twitter, which is Christopher Hole. It's on Facebook, Christopher Hole Training, or on Instagram, Christopher Hole. Come along there, like and follow. It'd be great to have you there. I'm sharing more stuff around health, fitness, anything and everything. Could be nutrition, could be exercise, could be an injury, could be habits, behaviors. As much as the umbrella covers, I try and share on social media. Alternatively, you can come to the website Christopher Hole Training, which has got on my blog again more videos and articles around injuries, exercise, nutrition, diet, conditions, habits, behaviors, anything again under that umbrella of health and fitness. You'll be able to find there. I've also got programs on there that you can sign up to and follow, which will help you build core strength, which will help you overcome low back pain, lordosis, different postures. So you can come along there, just have a look around. If you want to get involved in a program, by all means do so. If you just want to follow along on the blog, or if you want to come to social media, then that's absolutely fine too. So yes, back to today's whiteboard. We are talking about scoliosis treatment with the emphasis on massage. So slide 1, we are talking about the muscles involved in scoliosis. Now, I got this from Scoliosis, Muscle Imbalance and Treatment from the British Journal of Sports Medicine. Now, they would have obviously studied a selection of spines, a selection of people. That doesn't mean that those spines and those people are just like you. Your spine could be curved in a different way. Your spine could, or certain muscles could be, different muscles could be involved. So we have to take this on an individual case-by-case basis, but we can use this type of information from the journals to be able to give us better insight and certain areas to look for. It doesn't mean we have to take it as gospel. It just gives us avenues of investigation. So what we are talking about when we look at scoliosis from this perspective is we are looking at the muscles that are inactive and that have become weak. So we've got the convex side. Now, every scoliotic spine will have a convex side and a concave side. The convex side is the side that bulges outward, and the concave side is the inward curve, if you will. Now, what they found on the convex side, the trapezius, serratus anterior, glute medius, and quadratus lumborum were weaker. Now, those muscles, the trapezius is the big sort of kite muscle, the shoulder muscle at the back here. So we've then got the serratus anterior, which comes around the side of the rib and sort of goes underneath the scapula or shoulder blade. You've got the glute medius at the side of the hip, which is down here. And you've got the quadratus lumborum, which sits from the pelvis, up the spine, and across the bottom rib. So all of those muscles on the convex side, they found were weaker. What we then have is the concave side. It was a different selection of muscles. It was the erector spinae, which essentially goes all the way up the spine. So it would have been this portion here on the concave side. The multifidus, again, it would have been this on the concave side here, because on the convex side, it would have been tighter, and then that would be an area for us to massage. But we're going to look at that more specifically in a second. What we've then got are the rhomboids, which is the muscle that goes from the spine out to the scapula in a sort of horizontal, slightly diagonal, but horizontal fashion. So these are the muscles that they found were weaker. Now, again, what we generally find, and I do say what we generally find, is that these muscles, but on the opposing side, will then be the tighter, more weaker muscles, and these are the muscles that we would have to massage. Now, again, just as a quick background, I am a trainer and I am a massage therapist. I do work with a lot of people with not necessarily just scoliosis, but lordosis, so different postures of the spine that are affected, injuries and conditions of the hips, spine and shoulders, building core strength. So these are the types of things that I'm doing on a day-to-day basis. So I'm just sort of sharing this knowledge and experience with you through these whiteboards. So coming back to these slides, just to then sort of extend out and talk about the muscles that we want to think about with regards to massage. So this is the muscles and areas of the spine to massage, or that we want to think about massaging. Now, essentially, I've kept the convex side and the concave side, but I've flipped the muscles around, because as I mentioned, what we generally find is it's on the muscles opposite to the weaker side are generally the muscles that we want to that are overactive and that give the illusion that they're tight. So these are the muscles that we want to loosen. These are the muscles that we want to make slightly less inactive, and this is where the massage comes in, because massage is all about relaxing muscles. Now, the weaker ones that I talked about in the last slide, they generally are already relaxed, so we don't need to worry about those. So it will be the erector spinae on the convex side. So it'll be the erector spinae in this portion of the lower back. It will be the multifidus again in this portion of the lower back, and it will be the rhomboid on this side of the body. They will be the ones that will generally be tighter, more active, that we need to relax. If we then flip to the concave side, again, it's the opposing muscle. It's the trapezius. So it's this muscle up here that we want to be focusing on. It's the serratus anterior through the rib cage and under the scapula. You've then got the glute medius on the concave side, which is down here, and the quadratus lumborum on the inside here, which adjoins the pelvis, the spine, and the rib cage. So as a general rule, I can't emphasize that enough, as a general rule, please do take it on a case-by-case basis, but as a general rule, these are the types of things that I will investigate. I will try and find these areas, I will try and find these muscles, and if they are tight, it's not always the case, but as a general rule, I tend to find that it's these areas of the body that I work on. So hopefully that's given you a better idea of things that you need to think about when you are thinking about treating your scoliosis, or when you are thinking about getting someone else to treat your scoliosis. So again, if you haven't quite followed, because it can get quite confusing as I'm flipping muscles from each side of the body, so please do rewatch the video, review it again. If you need to take any notes, by all means take notes. Don't just take it and then feel confused. Actually, maybe just write down, draw the body out, think about where I'm talking about, and then plot that on your little diagram. So yes, do your homework, go and listen to other professionals, see what they say, and then slowly but surely you'll be able to treat your scoliosis more effectively, so you can get more from your treatment and therefore get more from your rehabilitation and management of scoliosis. So hopefully that's been helpful. Hopefully it's given you a better insight into the areas of the body to massage, into the muscles to massage, and it's giving you a better opportunity to go and either treat yourself or explore with other professionals what they can do for you. So many thanks for watching. Many thanks for listening. My name is Chris from Christopher Holt Training. I'll speak to you in the next whiteboard.